Okay, today we are evaluating a 28-year-old Caucasian male with complaints of syncope. Hi, my name is Christina. I'll be doing your exam today. Can you tell me your name and your birthday, please?
Yep, Brock, 5/30/90.
All right, and can you tell me what year it is?
It's 2018.
Okay, can you tell me where you are?
I'm at the hospital.
And can you tell me why you're here?
Yeah, I passed out a few times over the weekend.
Okay, patient is alert and oriented to person, place, time, and situation. Okay, Rob, can you tell me a little bit about what happened this weekend when you passed out?
Yeah, I was at a bachelor party and I just passed out. I guess somebody told me 3 times, and so then I decided to come in here.
Okay, what were you doing when you passed out?
Oh, we were just hanging out outside drinking.
Okay. How many drinks had you had?
I only had 3, so that's why I was concerned.
Okay, and so how what other things had you been drinking? Just a couple beers, like your
Just
usual?
I just had 3 beers that night, so
Okay.
and then really not much else throughout the day.
Okay. So what had you been doing prior to this event?
I earlier in the day I run quite a bit, so I ran 4 miles in the morning, and then we drove out to the buddies for the bachelor party.
Okay, gotcha. And you said you passed out 3 times?
That's what I was told. Yeah.
Okay, and when you passed out, do you remember hearing anything or kind of feeling anything?
Nope.
No? Okay, and so there were people around you when you passed out, correct?
Yeah, there are a lot of people.
Okay. And did you hit your head at all?
No,
when
not
you
that I
passed
know
out? Okay, gotcha. Did you have any other symptoms associated with this? Did you start feeling weak
Well,
or dizzy?
I guess I felt a little dizzy and nauseous.
Okay, and did it happen each time?
Oh yeah.
And were these episodes pretty close together or spread out?
They were fairly close together.
Okay. Did anything make these feelings worse when they came on, or did they just come out of nowhere?
No, but once I went inside and sat in the AC and drank a little water, I started feeling a little better.
Okay, gotcha.
I didn't pass out again after that.
Okay, had you been drinking water in the day, like after your run? I know you said you ran 3 or 4 miles.
Yeah, I mean a little bit, but not much.
Okay. Let's see. Do you have any past medical history, like hypertension, asthma, diabetes?
Yeah, hypertension. I was just diagnosed with it, so I just started Lisinopril for it a couple weeks ago.
Do you know the dose?
I don't.
Okay, and
I
you
can't
said
think of it.
you've been taking it for a couple weeks now?
Yep.
Okay, do you take it in the morning or at nighttime?
In the morning.
Okay, and had you had instances similar to this since you've been taking it?
Nope.
Okay. What about any allergies to medications?
No, none that I can think of.
Okay. Any family history, hypertension?
Yeah, mom
asthma,
mom has hypertension, and then I have a little brother that passed away when he was born due to a heart problem, but they don't know what exactly was wrong.
Okay. And do you have any seizure history yourself or within
No.
your family?
Nope.
Okay. What about your wellness visits? Do you see a doctor every year?
Oh yeah, I do yearly.
Okay. What about eye exams?
Yep.
Okay. And how's your vision? Do you wear contacts or glasses?
I do not.
Okay.
Vision's good.
Do you have any issues with like blurry vision ever, double vision?
Nope.
Okay. And did you have any instances like that during your episodes?
Nope.
Okay.
Just dizzy.
Okay. So you said you were drinking. How often do you drink?
I'll maybe have 1 or 2 beers a few days a week.
Okay. And what about recreational drug use or tobacco use?
Nope.
No? Okay. What about your caffeine intake?
Coffee,
soda?
I drink about 2 cups of coffee a day.
Okay.
And no soda or anything else.
Okay.
Just
gotcha.
Coffee and water.
Let's see. Do you have, did you say you had anxiety?
Yeah.
Okay.
So, yeah, I have social anxiety. I don't take anything for that, though.
Okay, and with that, do you have a pretty good support system?
Yeah, I do.
Okay, good. Let's see. Do you Do you have any other, I guess, issues or symptoms that you're concerned about related to your syncopal episodes?
None that I can think of.
Okay. All right. Have you had any troubles walking at all?
Nope.
No. Okay. What about issues with balance or memory, slurred speech?
Mm-mm.
No. Okay. And you said you didn't hit your head at all that you know of during these episodes?
Yeah, I don't think so. Not that I'm aware of.
Okay. And what about vision? I know you said you generally don't have any vision issues, and to clarify, you didn't during these episodes?
Nope.
Okay. What about any, did you get like super sweaty or diaphoretic before it happened or during that you know of?
No, I don't think so.
Okay. What about any issues with breathing? Were you hyperventilating at all in a situation? Like, were you with people that you knew pretty well, or were you comfortable, uncomfortable?
I was with some people I knew, but a lot of people I didn't know. So I mean, I have a little bit of anxiety.
Okay. All right. And what about any chest pain or palpitations?
Mm-mm.
Okay. And you don't usually have any issues as well?
No.
Okay. What about currently any nausea, vomiting?
No, not right now.
Okay, and just during the episode though, you said
Yeah.
you had that as well? Okay, that's right. What about any issues with going to the bathroom? Urinating, any troubles there?
It's been a little less lately. I feel like maybe over the past few days I haven't peed as much, I think, as I usually do.
Okay, and have you been running any more or less than you usually do, or about the same? 'Cause I know it's been
About the same, but I've been really busy too, so I'm
okay.
on the run.
Okay, and when you run, I know it's been warmer lately. Do you usually do that in the morning, afternoon, evening, or just does it depend?
Lately I've been having to do it midday for lunch, so
Okay.
I run outside on my lunch break.
Sure. And so it sounds like you said you lost consciousness when you passed out. Besides the dizziness, nausea, any really bad headaches or hearing troubles at all?
No.
No? Okay. All right. Well, I'm going to look at your vital signs here that they got from your intake. I know they did the vital signs with you laying down, sitting up, and standing. Those are orthostatic vital signs. The first set, laying down, was 138/80, heart rate 72. The rest of this initial set of vitals was temperature 98.6, O2 sat 98%, and your respiration rate was 16. Your blood pressure sitting up was 130/78, heart rate 77. Your blood pressure standing up was 121/71, heart rate is 75. So we do see a little bit of drop in pressure, but it's not enough to necessarily indicate orthostatic hypotension. So let's see. I'm going to go ahead and listen to your heart here.
Okay.
Okay. Okay. Rate regular, S1 and S2 heard, no murmurs, clicks, or rubs. I'm going to listen to your lungs now, okay?
Okay.
I want you to take a deep breath for me whenever I place this on your chest.
Okay.
In and out. Okay. And listen to your back real quick.
Okay.
Okay. Lungs clear to auscultation bilaterally. Symmetrical chest expansion, and I did listen over the shirt for video purposes. Okay. I'm going to check your pulses here. Okay. Your hands, any numbness or tingling anywhere?
Nope.
No? All right. Pulse is 2+, symmetric, regular, bilateral. Cross your legs for me, please. And slip your shoes off here. Okay. All right. Fetal pulses. 2+, symmetrical, regular, bilaterally. Cap refill, hands and feet bilaterally, less than 3 seconds. Now, let's see. Have you, I know I just asked about numbness and tingling anywhere. Did you have that previously or during the episode at all?
Nope.
Okay, and has your anxiety been pretty well controlled?
Yeah, just when I'm in big social settings.
Okay, good. Because that sheet that you filled out when you came in, the GAD form, so you scored a 3 on that. So it seems like you're doing pretty well with that. I'm going to go ahead and assess your cranial nerves here, and we should be getting close to the end of the exam, okay?
Okay.
Alrighty, so first of all, have you had any issues with smelling or identifying different scents?
Nope.
Okay. Have you had any vision changes?
Nope.
Okay. Alright, what we're going to do here, I want you to look at the pen, keep your head still, and track this, okay? Okay. Alright, look straight ahead here. Okay, pupils equal, round, reactive to light and accommodation. Pupils about 3 millimeters bilaterally, excuse me. Direct and consensual reactions to light bilaterally. Let's see. Oh, I'm gonna do something real quick. Can you open your mouth and stick out your tongue for me and say ah? All right, uveal is midline. Can you move your tongue from side to side? Perfect. Okay, now I want you to clench your jaw. Okay, good deal. And can you shrug your shoulders here for me? Perfect. Now I want you to turn your head against my hands to the left. Perfect. Now the other direction. Perfect. Okay, can you smile for me? All right, and frown. And can you puff out your cheeks? Okay. And let's see. I'm going to go ahead and test sensation on your face, okay? I'm going to use the safety pen or a paper clip edge and then a little swab here. And I want you to tell me if you feel sharp or sorry, soft or a dull or more sharp pressure, okay?
Mm-hmm.
Close your eyes.
Soft. Soft.
Was it the same?
Yep. Dull. Dull.
And was it the same?
Mm-hmm. Not dull.
Mm-hmm.
Dull.
And was it the same?
Yep. Soft. Dull.
Were they the same?
Nope.
Correct. All right, here. Let's see. I'm going to have you stand right here real quick for me. And I want you to go ahead and walk towards me. And then turn around and walk back. Perfect. Turn around and face me. Can you walk heel to toe for me, please? All right, turn around and walk back. All right, go ahead and have your seat back up on the here. All right, do you have any questions for me?
I do not.
All righty, well that concludes our exam. My differential diagnoses here are potentially vasovagal response due to the situation, being in an unfamiliar environment, the anxiety, prolonged standing, hot, humid environment, arrhythmia or a heart issue, maybe like Wolff-Parkinson syndrome or paroxysmal SVT, due to family history of family history of heart issues, or orthostatic hypotension, given the new blood pressure meds, as well as being dehydrated. Thank you.